I've been coaching people out of back pain for many years now, and nearly everyone believes that their pain was brought on by some kind of injury. They say things like, I hurt myself playing pickleball. I picked up the groceries the wrong way. I moved a chair. I fell off a tractor in 1987. I bent over to pick up a not that heavy box after moving from Florida to Colorado. That's how it started for me. The idea that pain means injury or damage is deeply ingrained in the American consciousness. Of course, if the pain starts while you're engaged in a physical activity, it's difficult not to connect the two. However, this is often deceiving. I'll explain in a minute. This pervasive concept of the frailty of the spine and the ease of injury has caused nothing less than a tsunami of chronic back pain. The American public has become an army of the disabled, fearful of every twist and every turn, careful not to bend over the wrong way. I've known many people who are afraid to play golf anymore because that's what triggered the pain initially. And this false narrative has been fostered by our medical community and other healers for decades now. Whether this is intentional to keep a steady stream of patients or not is really irrelevant. The assumption has been that any pain in the neck, shoulders, back, glutes, or down the leg is always caused by an injury or disease of the spine, or possibly by defective muscles or ligaments surrounding the spine. However, my own experience has shown that all of this is not true. I've seen hundreds of clients where the pain syndromes are the result of contraction in the soft tissue, such as muscles, nerves, tendons, and ligaments that have been brought on by emotional tension. And I've seen that when back pain is treated as a stress-based problem, the recovery rate is very high, and the cure is straightforward and permanent. Modern medicine and chronic pain. The medical community's preoccupation with the spine comes from their fundamental medical philosophy and training. Modern medicine has a primarily mechanical and structural orientation. The body is viewed very much like a machine, and any infirmity is just a malfunction of the machine. And the pain is always considered to be a sign of degeneration or physical trauma. And this problem has been compounded by the medical community's love affair with sophisticated diagnostic tools, believing that no diagnosis can be valid unless proven through imaging from an X-ray or an MRI. Unfortunately, it's been my experience that most back pain cannot be evaluated that way. The relationship between the mind and the body and its effect on the back cannot be measured using standard medical diagnostic tools. Emotions don't lend themselves to test tube experiments, and so modern medicine has chosen to ignore them, fortifying their position that emotions have little to do with chronic pain. Modern medicine doesn't acknowledge that stress and anxiety can cause back pain. However, when cornered, they will admit that emotional tension does aggravate back pain that's caused by physical injury. I saw a survey recently of primary care physicians where the doctors themselves thought that about 90% of their office visits were related to stress. Even so, most physicians are uncomfortable dealing with psychosomatic illness. Take, for example, digestive disorders, which almost everyone considers often to be caused by stress. However, when a patient presents with digestive problems, the focus of treatment is always medical, not psychological. And the failure of the medical community to treat the primary cause of the disorder is just poor medicine. It's the treatment of symptoms which has led to an epidemic of chronic disease and disability. There's a real disconnect because physicians see themselves as expert mechanics of the body when things like back pain are originating in the mind. And I get that to a certain extent. Back pain looks and feels very structural, making it particularly difficult to consider it psychological. And so doctors cling to a medical diagnosis even though the results are very poor. And this miscategorization of the origin of back pain has created what has become an epidemic of back pain in first world countries. What does cause back pain? So if doctors are wrong and structural abnormalities don't cause pain in the neck, shoulders, back, and glutes, what does? Well, there's a mountain of evidence that emotional tension causes a physiologic alteration of the muscles, nerves, tendons, and ligaments in these areas of the body. Chronic emotional tension tightens and inflames the soft tissue in the back, and over time, that creates the pain. There's a real medical diagnosis for this syndrome, which is called tension myositis syndrome. Stress-based back pain is real pain for sure. I've experienced it myself, and there's no doubt about it. But the good news is that the pain is harmless and should be treated as such. It's our experience that almost all back pain is stress-based and not caused by the spine at all. So this leads to a fundamental problem that's pervasive in America. If back pain is primarily a psychological problem, and if medical doctors are not trained to treat psychological pain, then how do you heal? Well, back pain that's not structural must be addressed both mentally and physically, but not medically. Indeed, the search for structural abnormalities of the spine can be counterproductive, and the treatments that follow are unnecessary and can even be harmful. That's why we put together a free back pain workshop that will set the foundation for your full recovery. You can find it at calmyourback.com, and there's a link below this video. Now, before you go, please hit that like button and subscribe button because it gets the word out and enables us to help more people like you get rid of their chronic back pain for good. I'm Laura Thornton. Thanks for watching.